Aloha, good afternoon, everybody. I'm Maleko.
Hey, I'm Flash.
And welcome to the Maleko and Flash podcast. We've got a very special edition of the podcast today as we bring you a coronavirus update for Hawaii, COVID-19 update here. And joining us today is Lieutenant Governor Dr. Josh Green. Thanks for joining us today.
My pleasure. Thank you guys for having me.
It's such a pleasure to be talking with you. I know you're extremely busy. We do have a short amount of time with you today, so I won't waste too much time with introductions, but we'll get right off the bat. Just before we started today, the number was updated. We now have a new update on the number of coronavirus cases in Hawaii. Do you want to quickly give us that update and let us know what you know?
Yeah, number is 95 confirmed cases. We're heading into the noon hour, so there may be imminently, any moment, some updates additionally. So this is about the time it happens. But yesterday we only went up 5, which is good. It's a good sign, and we're hopeful that as the days go by with the quarantine that we're able to keep it down. I can give you an update right now, real time, 106. We're at 106 now. It actually came in the last 10 seconds.
That just came in, right? 106 now. What is that? That's about 11 since yesterday.
That's right. So that's similar. 2 days ago, it went up about that amount. Then it went up 5. Then it went up 11. So that's, what we're kind of expecting. That's arithmetic growth, slow, steady, and that's better than a big spike. So that's what we're hoping for. And if we can keep this at bay with the home quarantine, we'll be okay.
Out of the 106 positive tests, how many tests total were given?
We've had over 5,000 tests now in the private sector and the public health department combined, though not all those tests are coming back. We're seeing usually about 3 to 4 days out. We're seeing results from 3 to 4 days ago on average. In some cases, we get same-day testing at the state lab, but that's somewhat limited. So what we're often seeing is this reflection, kind of a flashback in time slightly. But we immediately call everybody, and the Department of Health traces everybody right away.
Now, Dr. Green, one of the things that's been happening over the last few days is we've been watching the number of daily new results that come in, and we've been looking for a trend, and I haven't been able to see a significant trend upwards or downwards. We had really big numbers a few days ago. Yesterday, there were only a handful added. Today, there's 11. Are you able to discern from that? Are we seeing more or less cases on the daily here?
It is difficult to discern. What we're seeing. What the best thing I could say is we're not seeing a gigantic surge, and that's important right now. We're not seeing a doubling in the number of cases like a lot of places are seeing every 3 to 4 days. We have not been seeing that, and we're really hopeful that we keep this trend up. If we can keep this trend up, then we're seeing that the effective results of suppressing disease spread. A lot of places are jumping up in leaps and bounds, and when you get doubling on 500, then 1,000, then 2,000, it gets out of control really fast.
All right. Now, before we go any further here, it's tradition here on the podcast for us to begin with a word of the day and a trend of the day. And I know it's a little different today. I know you're on the job, but we just want to share with everybody what we are consuming here, what we're imbibing at home. Flash, of course, right into the whiskey like a true adult.
Yes. Josh. The more whiskey I drink, the whiskey, the alcohol kills the COVID-19, right? Like I need to be getting drunk to stay safe.
I knew you would be safe from the COVID-19, Flash. Somehow I didn't doubt that.
I've decided to go with a margarita myself. So take a look.
Wow, you're getting fancy.
My Tres Agaves margarita. I've got that going for us today. We need a word of the day, and LG, I'll let you pick the word of the day, something that will help us move the show along. Every time we hear the word of the day today, Flash and I are going to be drinking alcoholic beverages. I understand you've got a Diet Coke there. Is that right?
I got Diet Pepsi. How about the word of the day could be COVIDiots?
COVIDians?
COVIDiots. COVIDiots is a word of people who go out. They've traveled from the mainland here, and they travel around Hawaii, and they don't follow the rules, which is to stay indoors, and they possibly spread COVID-19 to our kupuna. So they're COVIDiots, is what I'm told.
It's also anyone in Florida.
And all of Florida. Okay. So if we've just lost the Florida vote for 2046, but that's okay.
So Florida's out, and we
COVIDiots.
people running tally here of people that are no longer going to be sponsors on the show or supporting us in the future. So we'll just put Florida on. We'll just pin Florida.
No Florida orange juice. Sorry. Yes.
There you go.
You guys have to drink.
Josh, I know that the last time we spoke, we talked about how many kits were available. How many kits has the state been able to order? And how many kits does the state have right now? And is this enough for anyone, just for today at least, that wants to get a test that qualifies? Are they able to?
My understanding is they are able to qualify. Well, they're able to get tests if they qualify. The qualifying factors have been if you're symptomatic, right? You have to be symptomatic to merit a test, because if you're not, test is going to be negative anyway. There are some circumstances where the clinician can make an additional determination if you've been in close proximity to a confirmed positive test, and that, is helpful. So if a COVIDiot is around and they get sick,
hey,
then because they've been in Florida and they are really, really feeling awful, and then they spread it to you, sure, there's a test. But I don't know, last I heard was 8,000 test kits that were arriving. And that's a lot of test kits. I'm going to have to defer to Dr. Miscovich and Department of Health to see the exact number. It fluctuates quite a lot. Our capacity to actually test remains about 250 per week from the Department of Health, but the private sector labs are able to obviously order a lot more tests. And they've gone to the neighbor islands because there was not as much neighbor island testing.
Are you
That's changed from the beginning is we used to get a daily update as to the number of tests that were performed versus the number of tests that came back positive. I was told that now, because we have so many private labs running tests, that number is hard to gather. Is anybody keeping track of how many tests we're running in the state?
Yes, we do get them bunched at a couple day intervals. Once we count all of the clinical labs, all the DLS labs, the Kaiser orders, the Tripler orders, which are a small number, and the Department of Health. So there was a count of about 5,000 yesterday of total tests ordered, but it does roll in, and they get the results in a rolling fashion too. Some of the tests took as much as 7 days, which is because there's a backlog on the mainland also. So both these issues are a challenge. This is a very fluid thing. It's kind of like, imagine if we were ordering amoxicillin, right, for ear infections, and there was a big outbreak of infection that caused a lot of ear infections. We might not know for a couple of weeks to collect from this doctor and that doctor in this part of the state and that part of the state. But those labs, when you add them all up, we can get the definitive answer.
What do we know about COVID-19 today that we didn't know, let's say, a week ago?
One of the big things is that research has shown now out of Iceland that as many as 50% of all the people with COVID-19 may be asymptomatic, meaning
Yikes.
a person may have contracted the disease and never developed symptoms. Now that's good because, in a way, because that means it wasn't so severe that it caused us to get severely ill and end up in the hospital or on a ventilator. But on the other side of the coin, that means a lot of people may have been walking around for some time, never became symptomatic, and were spreading it to others. So that's a big thing.
What do we call those people?
Well, those are relatives of the COVIDiots. Actually, they're actually okay. Yes.
Hey,
Hello.
thanks for playing along, LG. I appreciate
Yes,
it.
absolutely. But they themselves just didn't know. So they were genuinely innocent. The COVIDiots were a different crowd that flew in on $100 tickets to Hawaii, and they made it very difficult on us because right up until essentially this morning, there was a small window of activity where people could still come in without having the 14-day quarantine. Now, if anyone flies in, they're going into lockdown for 14 days, and that is going to have the effect of having no travelers except for people returning home.
Well, let's talk about that for just a second.
Hold on a second. Wait, Maleko, before we get into that, there's one question I want to ask as far as testing goes, because right now you're saying up to 50% of the people don't show any symptoms, and they never show any symptoms. But to qualify to get tested right now, you need to check one of a series of boxes. So in theory, with this new information, doesn't that mean that anybody who seems perfectly healthy should be able to get a test?
Well, so the approach we're using now, that's a very, very good question, Flash. And the approach that the private sector is using, and I think it's fairly smart, is that if someone's confirmed positive, right, we go to all of their contacts and we test their contacts. So the contacts of a confirmed positive person, so you would have been at risk. Let's say you and I had dinner together, then you start getting sick tomorrow, you test positive. Because we were in contact, then we test me also. That way, I may not be symptomatic yet, but I had a close contact in you, and I may be an asymptomatic affected COVID individual. Under either circumstance, it's quickly becoming a moot point because everyone's supposed to be home, but there are a fair number of loopholes in the home quarantine. So if you are with other people or coworkers that test positive, I think it's very smart for the clinicians to also test those contacts. We can't just test, say, 75,000 people in mass because we don't have that much capacity. But if we do this, which is what Korea did, that's how they beat it. They were able to contain it, and they didn't even have to go to a nationwide quarantine. We took an even more aggressive step, a statewide quarantine, hopefully with few enough loopholes or exemptions that we'll be okay.
Well, let's talk about the quarantine then that's in effect now. Yesterday, everyone who can work from home is asked to work from home. Anyone non-essential is asked to stay home. Today, we got the 14-day quarantine in effect. Logistically, how's that working? Are tourists being patrolled? Are we putting extra people in Waikiki to tell tourists to stay in their hotel rooms? How do we know if they're a local and they're going home and they're going to stay home?
It's challenging. What we do is when people fly in, the team at the airport takes that form that everyone loves so much, and they actually make sure that they filled it out legitimately. So they check it against their ID and they make sure that they filled it out appropriately. They also have to inform people, because some people may not, I'm sure they're going to be upset if they hear this, but may not have known they were going to have to quarantine in their hotel room. So we then have that information. We have their phone number. We can contact them. Now, again, it's going to be a very small number. As each day goes by, fewer and fewer people will, for whatever reason, come to Hawaii for it's a true stay in your hotel room vacation. It's going to be extraordinarily boring. So we'll see a smaller number, but people will also be asked to be off the street if they're just our local residents. So anyone who's out there, you can imagine they may get a question from one of the police department or sheriff's department. Why are you out? Are you okay? Were you going to a doctor's office or to go get groceries or what have you?
So with both of those quarantines in place then, everyone should be off the streets unless they're doing something essential. So if somebody arrived yesterday as a visitor,
Yes.
those people should be quarantined as well. Is that right? Or did they just get in under the wire and they can move about the cabin as freely as they want?
Well, technically, a visitor who came in yesterday or the day before the quarantine went into place on travelers, on visitors, they would have been in a loophole. But the numbers have dwindled very significantly. And of course, there are bans on going to state parks, beaches, and so on all over the place. So there's a lot of restrictions. Restaurants can't provide takeout. I think those individuals are going to be kind of in lockdown at their resort is my best guess. And there won't be a lot of other activities. Everyone else is going to be in the, kind of in the throes of this home quarantine. And that is already very, very significantly decreasing the amount of people that are out there with the other COVIDiots that came through a month ago.
Hey!
I got to tell you, traffic has been much better now that the non-essentials are staying home. I got to tell you that. That's been great.
Yes.
Well,
I know.
except half the island is somehow deemed essential. Do you think the essential list is too broad?
I do. I do think the essential list is a little bit too broad, but I also think that we're trying to balance it. Gov and mayors are trying to balance keeping us afloat and dealing with some of the critical stuff. I mean, each case you can imagine, like you have to have plumbers and so on, because if a main water main goes down, breaks, it could take down the whole building's infrastructure and services. So that's important. Or obviously people do have to eat. And so that's very important. There's a lot of important jobs. anything, we shouldn't be saying that if you're not essential, you're not important. You're very important, but we do have a tax extension, so that's less essential for this moment. So anything that can be put off, best way we can, we should. It's meant to be life supportive, essential services, things that you have to do, eat and get health care. And, you know, if a truck goes down on the road, we can't all be blocked in. So we need a tow truck, right? So it becomes essential. So there's a little bit of wiggle room there, but even if you're on the essential list and if you feel you can do it from home, please do.
So we're in this moment now where we've got this 14 days. We're hoping that we're going to start to see a significant drop in the number of positive cases. But there's a delay between when you become infected and when you could start showing signs. So realistically, when should we
If
start
you show signs at all, by the way,
from today's shutdown?
Right. Well, the average length of time, and this is just the median on a curve, a bell curve, is 5.2 days. So 5 or 6 days after we greatly diminished the number of people here, and assuming any of them were positive, you should start seeing a decline. Also, the virus itself, usually if you don't end up positive, or if you've been in contact with somebody, once it's 14 days and you don't pick it up, you're definitely in the clear. 5, 6, 7, 8 days. After 8 days, you're usually on the other side, far side of that curve, and it's very low likelihood you're going to get infected. So I would say after a full week, we'll see a real decline.
Okay, so you're saying we're looking at a week. That's April 1st. You first started talking about shutting it down and putting us in quarantine how many days ago? At least a week? I mean, you posted on your Instagram a week ago, but I heard you talking about it at least a week before that.
Yeah, I think I was considering it about, what is today, the 26th? I think we did make comments on it like on a Thursday. So
might have been the 19th, maybe even before that.
Maybe a little before that. And these are just thoughts. I do see a lot of patients and I talk to a lot of people, and it concerned me. This is so unusual. I mean, we never do this kind of thing, that I'm amazed at the things that are happening that we never tried before at all. The idea that cruise ships would get turned away for a time, or that we would go into a mass lockdown and have no dentists open. I mean, there's all kind of stuff that's kind of different and crazy. But yes, the writing was on the wall when other places started locking down also, and it became very clear. It's a very hard thing to do when you're a tourist community, but it will benefit us. It's going to benefit us greatly. We will be able to stop the virus in its tracks and not have a lot of fatalities. Now, how long it takes for the economy to return is a different thing.
So you're looking at this, obviously you've got your doctor's coat and then you've got your LG hat, right? You've got two sides of this thing. Those have gotten you into the news lately with maybe not seeing eye to eye with the governor. There was an article that came out a couple of days ago talking about how you might have been kicked off of the task force. The governor yesterday saying, no, that's not the case. And then I understand that maybe earlier today or within the last 24 hours, you and the governor had a heart-to-heart. How did that go?
It went great. It really went great. We have just very different styles. And maybe I was the COVID-idiot on that one, So, yeah. But we had a great conversation, and it was a matter of emphasizing really what I'm focused on, which is the healthcare response, because Hawaii is not Florida after all. And it was just my impression that we should do a few things differently, but me preparing for the healthcare response is what he wants. And that's a big piece of it. We're going to be doing a press conference together today. I think it's at 2:30 Hawaii Standard Time. And that kind of conversation needs to happen. If I can be frank, lieutenant governors across the country often do nothing and are, and are just waiting there until maybe they run 4 or 8 years after their governor. And I'm a pretty active person as a person goes, as a doctor and whatnot. So I'm always kind of revving my engine, and our governor is very thoughtful and very, he's very much an engineer, and he's a deliberative person. And so every once in a while, I'm sure that I piss him off, and that's completely normal. I've pissed a lot of people off in my lifetime, including my wife. So I'm not suggesting the gov is like my
I wouldn't know
wife,
anything
but I
about
am
that.
suggesting that there are going to be moments occasionally, you know?
Yeah. So you're literally like every other husband on the planet. Got it.
Yeah, that's right.
But
That's me. Yes.
I mean, you've been saying since February, you were the first politician locally, and you were very vocal about it, right? Right. I mean, a month ago, let's stop for the cruise ships for 60 days. And the governor didn't heed that. And even now, somehow cruise ships are still allowed to come in here. If or when are cruise ships not going to be allowed to dock anymore?
When are we going to shut it down, LG? When are we going to
shut it down?
So now they're only, now, right, the cruise ships are only coming when it's absolute desperation, where they've been refused everywhere, and the team goes to the dock and they have an actual plan to take people straight to the airport and off they go. They're actually chartering planes and things like that. So overall, the whole world ends up in this mess together. But anybody who comes into the state of Hawaii, I don't care how they get here. They get here, they're going into 14-day quarantine. So that is a strong piece that the gov had. And again, we sometimes differ. I was kind of screaming from the top of the mountain on that, because I was in Kauai when I saw one of the cruise ships roll up, and we only have 18 ventilators on all of Kauai. And I imagined for a moment, if they stayed and got sick, or got 30 of our residents sick on Kauai, what that would look like, and the fatalities that could ensue. So that became very clear to me that day, and that's how that recommendation came about.
So you were speaking from the heart, from the doctor. The doctor in you was like, stomping and yelling, "We need help," and the politicians were going, "Hold on, wait, we have an economy."
There was some of that for sure. And I was out for a jog and I saw that cruise ship, and I think that there are occasions where I'm not the most diplomatic person, but the ER part of me is, you see a problem, you go after it. And I've never really transitioned into the process, have 400 people build consensus thing. And I'm not even saying we're all there, because now we're moving faster than the speed of light compared to normal, of course, on quarantine capacity, on setting up homeless centers for possible patients, on testing. We're doing a lot of different things. But in that particular case, I just saw a bunch of infected people that were wandering around, and that was not going to work for us.
So from where I'm standing here, and correct me if I'm wrong, where this battle is being played out across the world is in hospitals, is in the emergency rooms. So doctors are making the final decisions on whether or not this patient gets a ventilator or this patient dies. And that's where it's going to wind up if we exceed our healthcare system. So
Right.
The doctor coat on you has to then be able to communicate that to politicians who think, well, we can't just shut it all down.
Yes.
Where does that balance fall in, and where are we going to expect to see you fall in the coming days, particularly as we start to see more cases?
I'm going to keep the absolute same approach. I'm just going to be a little bit more sweet about things, but I'm going to say exactly the same stuff. The need is to lock it down. And that's where the gov is. That's where the mayors are. That's where I am, which is a good thing, right? And I for instance, testified to the Hawaii County Council yesterday, and I said to them, we have to lock it down, and that we have to really completely close our loopholes, because the ER person in me sees those patient numbers rolling in soon, and then there's no policy discussion. Then it's just the numbers are in front of you, like you were describing about Italy. So I'll take that same tact. The good news is we are locking it down. The overall risk of infection is a direct equation. It's how much time you have in front of infected people within 6 feet. That's what happens, right? Now, some of them are invisible, like Flash pointed out, and some of them, because they don't have symptoms, and some of them may just be a day or two out from their infection. But since everyone's staying home, unless they really get short of breath and have a fever, and then they've certainly got COVID, we think they do, and they go to the hospital for a check, we will see way less spread. I'm hearing, of course, all sorts of notes and calls and all sorts of things and stories from people about this group of kids is playing, this auto dealership is staying open, this mattress store is staying open. But as of today, everybody who isn't, who can't argue that they're essential with a straight face needs to be home, and they need to be essentially home until April 30th. And if that happens, Hawaii is going to be really pleased that we did not have virtually any fatalities as a result of extra cases of COVID.
What you keep mentioning shutting down. What is your definition of shutting down the state, and what more could or should we be doing that we aren't right now, in particular as it relates to travel, the cruise ship industry, the airline industry? Obviously, a lot of people, I know people are hitting up Maleko directly, me directly, you directly, asking these very questions.
Well, I don't have a policy position on this yet, but the mayors are having obvious discussions with the communities and the governor about whether or not they're going to shut down inter-island travel. And that is a whole nother level, because what we could see is say, no cases on Lanai or Maui if that happens. Let's say we get down to 0, but there's a surging of cases on Oahu. Then the mayors will have to make a decision of how strongly they appeal to the governor to not have any inter-island travel for a time. So that's another kind of big, that's just a big question that in the coming days, I think we're going to have to wrestle with. Again, I'm very focused on one thing, and that's everyone quarantine at home. Everyone that possibly can do it should do it. If you guys do that, we're good. And I think that you're going to get a lot of additional information from my colleague, Dr. Scott, who's going to come on. He's, for instance, a very passionate person about testing, getting the clinical picture very well spelled out. He's a smart dude and a good guy. And so that's the kind of stuff, the big decisions that are going to get made. As long as we have enough tests, we're going to use them to test people and get to the bottom of exactly where our cases are, so that you can feel safe and your loved ones can feel safe, and that people can feel safe when they're off even at the grocery store.
Before you go, I know you're running short on time, but I want to bring this up. I saw this last night. There's a petition to let Josh lead. Have you seen?
Let Josh lead!
This moveon.org petition that people are asking. You've been outspoken from the beginning of this, and while we do have leadership in our legislature, we do have a governor. From a medical perspective, from the layman's point of view, you've been very good at explaining with clarity how we can deal with this best. And I think more than any other politician, I can say personally, I've looked to you for the most logical advice. Now, that seems to be resonating with other people too. That petition already has several hundred signatures on it. Any comment on that?
Yeah, I think my mother started that petition. So I think it's probably a moot point. I'm happy to lead alongside of everybody else. I'm just going to give the vocal ER doc lieutenant governor position. And that will be one voice, and it will usually be heated because most people are very focused on decreasing the spread as the top priority. There are other priorities that are important, and we got quickly to a lot of these priorities with testing, the cruise ships, the travel bans. So it's there, and thank God we only have 95 cases right now. That I would be horrified if we had 2,000 and they were spreading. We would be in deep, deep, deep trouble. So look, drink up for the COVID-idiots.
Hey!
COVID-idiots!
And drink Florida orange juice once you're feeling better. Some people think vitamin C is a helpful, and it may be a helpful approach, but the main thing is prevention. And an ounce of prevention equals a pound of cure. Boring, traditional, but actually very valuable when you're trying to not get coronavirus.
Lieutenant Governor Josh Green, by the way, there are almost 7,000 signatures. I'm looking at it right now. There was 7,000 is the goal. They've got 6,994. So by the end of this podcast, you will have reached your goal. I don't know what that means, but yeah. Hey, maybe you can print it out and frame it.
I got a big family, but if you guys could do me a favor and share, let people know that they can get in touch with me on social media. That's at LTGov Josh Green. That would be really helpful. At LTGov Josh Green. And I'll be there with you guys again. I'm so sorry we have a little less time than I would like to today. Trying to stay ahead of calls and personal contacts to make sure that everyone's getting the right idea and we're making good decisions.
Well, it's been great talking with you. I know you're busy. We'll talk to you again soon. Thanks so much for your time, and we'll look for you at the press conferences as part of that task force from now on.
Where you should be. That's where he should be, right there, every time. And by the way, Dr. Josh Green was Physician of the Year back in 2009. This guy knows what he's talking about.
Thanks, Flash. Thank you, Maleko. I appreciate it, dudes.
Bye-bye. All right, so who's coming on now? You're going to pass us off to someone else, right?
Yeah, I'm passing you off to Dr. Scott Miscovich, and this dude is the bomb. So enjoy, and he's also a character. He's a wonk, and you're going to get that right off the bat.
I love it. All right, cool. Thanks so much.
Thank you, Dr. Josh Green, Lieutenant Governor Dr. Josh Green. I still don't know how to address him. Is it Lieutenant Governor? Is it Doctor? Is it Josh?
I say OG every once in a while. I don't know. We're getting a tour of the office right now. This is kind of cool.
Yeah. Maybe we just refer to him as not Kermit. I don't know.
Hey, there's Dr. Miscovich right there.
Hey, I recognize you guys. I've already been down there with you guys. So, yeah, how's it going?
Well, it's great talking with you. We've been seeing you on these press conferences and hearing from you as well. You've got a good handle on this. Maybe you could just kind of brief us. We had another 11 cases come through here in the last 24 hours. That, of course, indicative of how many tests we've been giving. How is the testing process going here, and how are things from your perspective?
Well, actually, I can just tell you off the press, it's 12, because while you guys were talking, I got a positive call, and I just hung up. Sitting in the other conference room while Josh is talking with you, going through the process of what we do when we get a positive. So I just called one of my patients who was tested and just finished going through 15 minutes, 20 minutes, got his wife to come in, gave him some comfort, basically told him, listen, I'm going to be calling you 2-3 times a day, and made sure he has food at home and provisions. And so there's another one that hasn't been reported yet. And my guess is by the end of today, with the testing that we're doing, that I'll probably have another 4 calls at least, or 5 calls today, because our group, because we're doing about, I think we're up to about 1/3 of all the tests have been done through my group and my teams. We're going to just keep getting tests back every single day as the labs are catching up.
Now, I'm not in a position where I need to get tested, but for many people, it's a concern. If they do come to that point where they may have been exposed and they want to go in and get tested, walk me through what that patient-doctor relationship is like, that initial conversation down to the conversation you just had where you say, I'm sorry, you are positive for COVID-19, and then you have to walk them through their family relationships as well.
Well, the answer is we still need to talk about the fact that we're screening for symptomatic patients. We're not screening asymptomatic yet. The public should be on hold because the policies are changing. The types of tests that are available are changing. I'm on the line, since I'm getting these referred through Lieutenant Governor's office, these people that are now coming up with FDA-approved blood tests. So actually, we're going to be piloting starting Saturday. First, we're going to probably have the best pilot in the country of a blood test that takes 10 minutes for what's called antibodies. So that's going to show if you are already in a little bit of the healing phase or if you're in the early phase. It's not going to show the acute diagnosis. So we're going to have something that we're going to pilot there. So bottom line is, it starts with, like, if you talk about a drive-through, it starts with us essentially having a large queue of cars coming in. We have many people, they're all physicians, physician assistants, or nurse practitioners that screen them. And then we have stations. And like, we're going to be at the Waipio Soccer Peninsula on Saturday, Kaka'ako again on Sunday. And the doc, or like myself, I've been at the front lines, have probably screened up to 1,800, 2,000 individuals. And I start out with a question. Can you tell me what your concerns or symptoms are? And I'm teaching my people to do that, because listen to that. Usually in medicine, we're told not to ask dual questions. You ask one question at a time. But I wanted to have it open so that a lot of people show up because they have concerns, versus if you just say, tell me your symptoms, and they tilt their head and they go, oh, I don't have any. You want to make them feel welcome, because part of these drive-ups are to also calm the public. They're to give them a sense that someone cares, there's a place to turn to. And so we lead them in, like the Kona testing we did. I think we tested about 1 out of 7, 1 out of 8. And a lot of them just got off crazy trips from all over the world. They were totally stressed out and they just wanted comfort. They were asymptomatic. And we explained to them what to watch for and that they did not need to be tested. So that's step one. Now, at one point, you're turned and cued the other way and say, thanks, you don't need to be tested. You go to the next station. Someone's going to hand you paperwork. Because at this point, we want no touch. We want to protect our frontline workers. It's a really simple front page with an address and your insurance information. If people do not have insurance, we are not turning them away. Not at this time. We're just treating everybody. But if there is insurance, insurance has promised to do the testing, provide all the follow-up payment for everything with no cost to the patient. So that's the free part of it, right? It's no cost to the patient, but the insurances are kicking in. You then go to a station where that registration is taken. They have you hold up your ID and your insurance card and that paper. Its picture is snapped. There's a team that's entering, so we create a record right away because we cannot fail on having accurate data attached to that swab. And so there's a team entering it right there, creating a full record. You go to the next station, and now you get into where people are in the space gear, or what we call the personal protective equipment, and you will get a temperature swab across your forehead, and you will have a little device put on your finger, which is checking your pulse level and your oxygen. Like in Kaka'aka with that data, we turned some people right to the emergency room because they were too sick. And then finally, the last cue is you'll go to having the actual swab done. It's a nasal swab. It goes into both nostrils. And if I turn sideways, it goes pretty deep. It goes halfway.
Oh my God.
Yeah, it's pretty deep. Because it has to go into what's called the nasopharyngeal area, which is one of the highest areas of viral concentration. And I found about 50 to 60% of the people will get a little lacrimal response, which means you're not actually crying from fear, but you'll get a little tear response. Some people will sneeze, and that's why everybody's in shields. But when that's done, you're driving away. And yeah, but it's important. It's not painful. It's not painful at all. It's just like, someone sticking a little thin tube up your nose.
I'm telling you.
Yeah. By the way, classic doctor comment. You know when they come at you with the 4-inch needle? This is you're barely gonna feel this. It's just a prick. Okay, doctor. Yeah.
No, not my team. We just tell the truth, man. We just tell the truth. But the truth is, seriously, it's a very thin probe. It does not hurt whatsoever. But it just, you can almost feel like you start to taste it up in the back of your, of your throat,
Jesus.
But that's what you need. I mean, that's how we get accurate data. So now wait, there is an alternative because where one of the highest concentrations of virus in the acute phase is found, it's in the stool. So you got to watch what you ask for, guys.
Yeah. Well, let me ask you a question then. How long does it take for the patient to go from that swab and that sample to be sent off for them to get the results back right now?
Okay, I'm glad you're bringing this up because I hope people are listening to this. We have two major labs.
But probably not. There's probably nobody watching or listening.
Okay,
well,
okay.
My mom.
Your mom. Hey, mom. Hey, mom. So bottom line is you can basically, we have two labs, diagnostic and clinical. We've been sharing the swabs equally to both of them. They're being sent out to the mainland right now because they're just coming up with local testing. And it's still not up to speed. They're saving the tests that are the 24-hour turnaround for hospitalized, very acute patients. And unfortunately, one of the mainland labs has been doing fabulous. We're getting 2 to 3 day turnaround. The other one has just gotten pushed where suddenly we have 6, 7, 8, 9, 10 days. I have people from Kualoa, which is 9th day, and they're still not back yet. And that's very disturbing because a lot of the people, and I'm not blaming the labs, the volumes through these labs are tremendous. These people are now sitting at home in home quarantine because that's another thing that's important. If you're qualified to do a swab, you are then given information and even could be a handout to show you are now to be in home quarantine until that result comes back. Because if you've qualified for the swab, that means that you have enough symptomatology that you need to put yourself and separate yourself. So some of these poor people are waiting for calls, and just to show that there is no preference, I am on regular calls from different senators and House of Representatives that we swabbed when we took a team down to the Senate and House. They're still not back yet, and they're in home quarantine because they're treated just like everybody.
How many days is that we've been waiting for those?
They were last Thursday, so today's a week for the Senate and House.
So they could
We did
be-
Thursday, Saturday down there.
So it's possible they don't have COVID-19 and they've quarantined this time for nothing.
Well, I would not say anything's for nothing. I mean, when the disease is as virulent as this, there's no such thing as for nothing in this. We've got to take precautions, right? We've got to take precautions. So yes, did they get quarantined with no disease and no active disease? Yes, but that's how we're going to stop this in our state right now. Just not taking any chances.
Are you saying that there's no local labs that can do tests, that all the tests need to be sent to the mainland?
The Department of Health does some, but they're very, very few, and they're kind of doing them for the hospital a little bit, and then they're sending out these surveillance tests, which a lot of us are scratching our heads on that. And then diagnostic and clinical are basically, they both have geared up the process to do the labs locally, but they're just getting up the speed to start broadening the quantity that are coming out. And the quantity is small. One of them's doing 50, the other can do maybe up to 200 a day, which relative to the numbers we're going to start putting out. To give you an idea, right now, even in last week, they were getting a quantity of 400 to 500 a day starting to come through about the last 4 to 5 days. So it does exceed the supply-demand curve.
How come you're the only one that is doing the drive-through clinics, or at least you were the first, and you seem to be the most predominant? Where's everyone else on this?
I guess we asked that question, but let me tell you the good news.
It's a lot of ums and ahs there.
Yeah, there's a few too many ums and ahs. I'm looking over my shoulder. I'm trying to figure who's up on my shoulder. That's some cool picture. What are they surfing?
Well, I mean, let me just put it this way: before all of this began, you're a family practice doctor. You had your office there at the Castle Professional Center in Kaneohe.
Right.
You're seeing patients for general practice medicine. You weren't especially prepared to do this. You just decided that someone needed to do this. Am I right?
Yes. I don't know. I keep looking back to my nighttime prayers to my late mother and father and say maybe they prepared me all my life to do this, because I'm not giving up. This is when you stand up for the people. This is why I became a doctor. This is why I serve the Windward community. Now, I am a little larger than that. I do own the urgent care over there. I have 4 other offices. I have 100-some employees. I have about 15 other physicians, nurse practitioners, and PAs. So I do have an amazing team, and I got to give a shout out. I just spoke to them almost in tears, telling them that they're the most special people, because they're all putting their life at risk. And it's so selfless. They're just out there and they're just like, no questions of what they're doing. And I just told them, as we look back on them, this is going to be a legacy for their life, for their kids, their family, because what they're going to do is just, it's incredible.
We both have a lot of very young millennial Gen Zer followers. Some are finally catching on, but a lot of our young followers still don't get it. What would you say to the people watching or listening right now that are in their teens, 20s, about what's going on?
Okay, let me just give them a fact. Right now, New York City has become the epicenter of the world. The data as of this morning, I think it's 40% of every admission due to COVID is under the age of 40. So if you don't think you're, that you're immune to this, and there are people that are dying under 40, and these people are healthy. That category we're talking about are not chronically ill. So this is a massively destructive virus. When it gets into your lungs, it's destroying the parenchyma of your lungs. It gets in and literally just destroys it. And people are coughing up blood and having difficulty breathing. And they just need to know what social isolation, social separation means, and that they are not immune to this. And we are going to be reaching out to them. The meeting I just came from, boy, I don't know if we're even gonna have enough time to talk about what we're planning next, but you know, I just met with teams of people that are about to just take this on. I have a team of 7 people, very talented, that came from Jellybox, Sandbox, that, you know, group working area that we've just hired on. And I want to give a big shout out to Hawaii Community Foundation, Mike Akane and his team and his board, through my nonprofit, which the Lieutenant Governor and I started through the Homeless Initiative. I think we're up to 1.7 and another 500,000, a couple $1 million coming from the philanthropic community to support this effort, because, you know, the people who are really caring and intelligent understand that you look at the model, you look at what's going on in the world, we need to test, and do more testing, screen, follow up, quarantine, and then repeat. And that's what we're going to do over the next 4 weeks. We're going to be, you know, my goal is we're going to show the world and the United States that if you do this and you do it right, we are going to, in 4 weeks, have that proverbial curve flattened. So it is going to be where we're going to be just then chasing the clusters. And that's what will happen. You know, this, just a warning to everybody, this is not going away. This is not going to be one of those things, oh, you know, 1 month we're fine. No. This is staying. But what we'll do is once we've got it out of the broad population, then we're going to chase clusters. And those will just like a little outbreak here, a little outbreak there. And you just need to stop that before it turns into something where it goes into the broad population. And I was asked by some of these donors that are philanthropic, that are into large businesses, like, when are we going to open Hawaii back up? Well, if we can do this testing, flatten the curve, and make sure we get our residents safe and make sure we have this under control, it's going to be the quickest way to open the state back up and to you know, allow, if people are coming, they got to be safe. And my goal, just to give you a little bit of future, I believe that if I could plan out 4, 5, 6 weeks from now, we're going to have a rapid reagent blood test available for the initial diagnostic phase. There are some available. They're probably going to need a little more prime time. And we're probably going to be able to have people pop their finger before they pop on their flight from Atlanta or New York and say, welcome, here you are, you're negative. You're welcome to our state. I mean, that's, yeah, that's theory. That's the little ponies dancing in my brain. That's, right? Okay. Yeah, that's the hope. Yeah.
You just said you left a meeting where you guys are planning on doing something to reach out to these youth that maybe think that they're invincible from this. Can you tell us a little bit about that? Are you able to divulge at least what we can expect, what's coming?
Well, we just hired 7 people that are really crazy great, technologically capable, and they're going to fire up major communication channels. My vision of communication is going to be the public, the people of Hawaii. Another big group that we need to talk to are the employers. There's so many misconceptions. I just had employees coming from a work site where somebody's brother was positive and they shut 400 people down to say, you have to go get tested. It was like, whoa, we can't. Those are the only people that can work. We need to get reality. That doesn't need to shut down. So we need to talk to the employers. I met with 2 major unions yesterday, and I'm talking about what we can do for the unions. And then finally, we need to talk to the health professionals, because there's varied information through the health professionals, and we need to standardize it with, you know, the Lieutenant Governor's team, which he's having me lead. So that's one route. In that route, in the communication, is going to have to be target-specific communication. The millennials, the seniors, different languages, different educational levels. We're just going to try to. Did you get tested?
Good form though. That was good form on the cop.
Yeah, I like that. You know, we're you know, like, you know, some of those things like Tim Tebow, you know, we did the different things. Maybe that's going to be the COVID.
Oh, I like it, the dab.
Yeah, there we are. You know, that's
called the dab there. Yeah.
Yeah, it's going to be the COVID dab.
What would you say? You said there was a company had one person that had someone that they knew test positive, and they shut down a 400-person company. what would you say to the business owners and managers about what to do? What would the protocol be? Because Maleko and I know firsthand, not everyone has these policies in place yet of someone in your company test positive or someone in your company knows someone that tests positive. What do we do?
We are basically, that's what this organization, which is going to start to be operational Monday, Tuesday, we're going to have a phone number. You're going to call us and we're going to answer those questions. We're going to have medical professionals, teams of people to get you the facts. And we want it to be a unified fact. Like, for example, this has happened. I have had true positives. And just this morning, earlier, I probably have had 5 people. We have 2 phones right now that are iPhones that are COVID hotlines. We have 1 in the unions. We have 1 for employers. I'm going to have more, and we're disseminating that number. Someone's answering it, and we're going to have massive phone banks. We have 20 new phones installed in this call center. And they're going to call and talk to a factual person who will explain them what's the policy and why.
What can you give us that number now? No.
Maybe I can. Maybe I can. My staff who's holding it will die, but let me pull up one of them here and see.
Let us. Can we ask this? Can we get you back on next week when all this stuff has been public and launched, and get you back talking about all these initiatives and phone numbers and websites and all that good stuff?
I'll be happy to, because there's a whole lot we're going to talk about next week. Believe me, a lot that's going on. Of the meetings I just came out that are going to be, I guess I'll put it this way right now. We're going to call it different types of names, but essentially with this group and with everything else, I just came and met with a whole group of what are called nurse case managers and high-level health professionals. Essentially, if you listen to some of the call-ins yesterday or some of the Senate hearings, there was pretty straightforward discussion from, I think, Sarah and Bruce that they can't deal with any more testing because they don't have staff to do any follow-up, and they're just like, sounds like they're hitting their max. Essentially, we're setting up a private version of the Department of Health.
Wow.
All right,
and
well,
it's operational Monday. We're ready for Monday. It's been going on, and we're open for business. That's how far along this is.
One more question for you, Doctor. What should all of us be doing as far as getting our own personal PPE together if we can find it?
Good luck, man. Yeah. No, it's like for an individual, the best thing to do is not hoard PPE or find it. Is just stay isolated. Stay isolated. And if you do have coughs and symptoms, it's best to socially isolate. You shouldn't be, as an individual, worried about finding big old face masks or space suits or the N95s. Those are in such short supply. And fortunately, I just have been in contact with someone from San Diego, and I just ordered 25,000 through one of our organizations. Those are going to be going to the frontline medical people because we are so short of them. And the other thing you have to understand is we don't qualify to get the federal hospital, supplies that are there in emergencies. I'm a private group. I'm fortunate. About beginning of January, I kind of saw this, and because I'm a little wonky, I said nope, and I bought tons of it because I just was following the whole process. So when we're still buying it from all over, and it's expensive, so it's still in very short supply.
Is there a website or social media that we can be checking on Monday when all this stuff launches? Can you divulge that now? I was boring, and my tech people and all the people now that are looking at me, I think, are going to be overruling. But when I woke up with this idea last Wednesday night, I went and bought the Hawaii COVID hotline.org and .com. But the bottom line is, I'm sure there's going to be a much more creative name that they're all going to come up with, because that's just a staunchy doctor's name who, we're doctors. I write with hammer and chisel. So we'll have something creative, and we'll announce it. No, you don't. You write with chicken scratch like every other doctor.
Yeah, I just want to know. I'm an animal lover, and I always have dogs in my office. I want to do a paw print. I don't want to write. I just want to put a paw up there and stamp it. So.
There you go. Yeah. Just stamp it. Thank you so much for joining us today. Is there you have personal social media that people can follow you right now?
Right now, my most common social media is just my Facebook, which I've opened up to the public, and it's just under my name, Scott Miscovich. And please join me, because every day or two, and it's almost every day now, I'm posting just updates on what we're doing. And you know, my staff is posting some photos from these amazing drive-throughs and some of the people in the field and the volunteers. It's just incredible.
Dr. Scott Miscovich, thank you so much for talking with us and for doing what you do, for doing these clinics and getting as many people tested as you can. Appreciate your efforts in helping us battle this COVID-19.
Happy to talk to you guys, and keep up your good work. Your job, keep the public safe and calm, and hang in there.
Thanks
Hey,
again.
hey, Doc,
Yeah.
after we get off, I'm going to get your contact info. I'd love for you to do a round of interviews with all the radio stations at iHeart Radio Honolulu next week, once you launch that initiative.
Okay, sure.
All
No
right.
problem.
Thank you.
Thanks.
We're going to let Dr. Miscovich go here. Flash, next week, obviously, we're going to be talking more about COVID-19. We're going to try and get more people connected there. One of the things that we want you to do is, if you haven't already, make sure you go to our website, malekoandflash.com. Subscribe to our podcast there. If you listen to podcasts on your phone, wherever you listen to podcasts, whether it's iTunes or Spotify or Pandora or any other app, you can subscribe to the
Whatever.
Flash podcast there as well. And we're just going to keep doing these. Since we're doing these virtual meetings now, we can just keep whipping these out. Of course, we're also doing our Instagram lives, where we're the two of us are going live together, and we're just talking about those daily press conferences.
Which, by the way, apparently we're going to be doing one today, because we just found out there's a press conference today at 2:30 with Lieutenant Governor Josh Green will be back at the press conference after being MIA for a couple weeks.
He's back.
You know, we only had him for 30 minutes today, so we didn't really get to dive into his relationship with EGAY and all that and get into the nuance of it. And I think there's a good chance we'll have Dr. Green back on the podcast next week, as well as Dr. Scott. I couldn't even remember his last name, but
Miscovich, Dr. Scott Miscovich.
It's hard to even say who our guests are going to be next week, because this is just such a moving target. It's such a fluid situation. We will say that moving forward for the foreseeable future, we are going to have on the podcast all the right people that you need to be listening to get the best information and the most locally sourced information that is correct.
Jeez, are you already drunk? What's going on with you? Finish the sentence.
I don't know.
You had to drink there, buddy.
Listen. I'm. Dr. Scott isn't drinking, but I'm like three bullets in at this point. And I saw you.
I can tell.
Correct me if I'm wrong. Did you not finish your bottle of margarita?
I'm about to.
Yeah, I saw you pour the rest of it in the glass.
Or do you want to hear yourself talk some more? Are we done?
I would love to hear myself talk more, but we're done. MalekoandFlash.com. Thanks for listening, everybody.
Bye.